the last one from Dr. Mirsaitova, St. Petersburg, sharing us using femtosecond laser refractive surgeries.
Good afternoon, dear colleagues. Thank you for invitation and allow me to present the report. Myopia and high myopia estimates from 2000 to 2050 significantly suggest increases in prevalences globally. Refractive lenticular extraction technology is becoming increasingly popular as a flapless and minimally invasive form of laser vision correction for the treatment of myopia. 500 kHz VisuMax platform with a pulse energy from 100 to 180 nanojoules is used for SMILE. The purpose of the study was to investigate the optimal femtosecond laser low energy with the aim of improving clinical outcomes during the early postoperative period after SMILE for correction of myopia. Our clinical trials included 123 patients. We retrospectively and prospectively compared the visual outcomes in 3 groups, dividing according to the laser energy levels. Retrospective groups underwent SMILE at conventionally used energy levels of 150 nanojoules, and other 2 groups underwent SMILE using lower energy levels of 140 and 130 nanojoules. All patients underwent a baseline preoperative assessment and additional research methods. Observation periods include 12 months. The operation, according to the standard technique, were performed by the same surgery. The surgical parameters were as follows: pulse energy from 130 to 150 nanojoules, spot distance 4.5 regardless of energy, gap thickness 120 microns, and side cut width 3 millimeters. We also perform quantitative analysis of black areas using computer program. A bale that occurred in the posterior plane of lenticular was divided into 4 levels according to the maximum covered distance. A bale that occurred in the anterior plane of the lenticular was divided into central or diffuse. Optical densimetry was evaluated using pentagram in different concentric zones and in different depths. The preoperative clinical features of the eyes by groups are presented in the table. All data were collected and imported into statistics for Windows software. Developed a device to determine the force required to dissect the lenticular after SMILE to select the optimal laser energy levels. An experiment was conducted on 25 cadaverous pigs' eyes. 5 energy levels were studied. During corneal tissue separation, the spatula acts on the resistive thin film pressure sensors, which are connected to the Arduino unit and transmit all information to the computer using a Bluetooth module. The results of all sensors are displayed on the screen in the form of graphs. The results of comparing the groups are presented in the table. It was found that the use of high energy levels was accompanied by easier separation of the interstitial bridges, and the energy level of 120 nanojoules was relatively too low because at this level there was a high occurrence of black spots and areas. In study groups with low and moderate myopia, UDVA at the first day after SMILE using an energy level of 139 joules was significantly better than the using an energy levels of 159 joules. In the subgroups with high myopia, better UDVA the first day post-operation were obtained using an energy levels of 140 nanojoules. There were no statistically significant difference between the groups at follow-up. UDVA remains stable. The distribution of various degrees of OBL is listed in slide at the posterior and at the anterior plane of lenticle. In the group without OBL, there was significantly more UDVA 1.0 or better than in the group with OBL. The binary logistic regression method was used to estimate the probability of OBL occurring in patients. The following predictors were considered: K average, age, gender, spherical and cylindrical component, central corneal thickness, degree of myopia, femtosecond laser energy, and residual stromal thickness. The slide shows the formula for predicting the probability of OBL occurrence after SMILE. The results of our study suggest that an energy level, CCT, and myopia degree are an independent risk factor for OBL formation during SMILE surgery. These outcomes demonstrate that 140 nanojoules induce the smaller occurrence of black areas during treatment in patients with initially high myopia. Multifactorial analysis showed that the studied energy levels, about 140 nanojoules, didn't adversely affect the state of RMS total densitometry and total pachymetry, and there was also no dependence on the degree of myopia and the energy levels of laser. In addition, these results may indicate a high degree of satisfaction and long-term quality of life in the patients with low and moderate myopia after SMILE with energy levels of 130 nanojoules compared to an energy levels of 140 nanojoules. No significantly differences were found in the subgroups with high myopia. Conclusions. All the low energy level settings from 140 to 150 nanojoules achieved good visual outcomes, but energy level of 130 nanojoules in patients with low to moderate myopia leads to higher UDVA on the first day and provides a significant improvement in quality of life 1 month after surgery. For high myopia, we recommend using an energy level of 140 nanojoules. The results of our study suggest that the energy level, CCT, and myopia degree are an independent risk factor for OBL formation during SMILE surgery. Multifactorial analysis showed that the studied energy levels about 130-149 joules didn't adversely affect the state of total RMS, aberrations, densitometry, and pachymetry, and there was also no dependence on degree of myopia and the energy level of laser. Thank you for your kind attention.
Thank you very much. That